Hypertension is not an acute illness like sinusitis or tonsillitis. A urinary infection has a start and finish, so it requires treatment on time, a treatment defined by specific dosages and precise timing. Hypertension is a chronic disease, so it needs ongoing treatment. Once it starts, it must be monitored and treated. Many people mistakenly believe that the first 2 boxes of medicine prescribed by the doctor are the cure for hypertension. Once the 2 boxes are finished, they think the problem is solved, but this is a serious mistake and underestimation of the issue. The justification for having told the doctor about a high blood pressure reading 3 months earlier should only refer to ongoing reports to the doctor, so that over time they can manage any necessary adjustments to the treatment. People diagnosed with hypertension know they must continue measuring regularly. At the very least, they should identify a condition that is repeatable. Therefore, at that stage, one can also decrease the frequency of measurements, but it should still be at most every 2 or 3 days or once a week. Ultimately, spending 3 minutes of your time measuring blood pressure does not drastically alter your daily habits and schedule. Finally, I must mention another phrase that often arises. Doctor, my blood pressure is fine, but when I visit the clinic, it shoots up to the stars. This condition is scientifically codified. It's called white coat hypertension because it involves contact with a specific environment, the official measurement of blood pressure, an unfamiliar person, an atmosphere that induces fear, the need to rush to a clinic, or possibly the physical effort of climbing stairs, navigating unfamiliar spaces, or dealing with time constraints. All these factors can make the measured blood pressure value inaccurate, inappropriate, and misleading. Blood pressure should instead be taken at home in a familiar, comfortable, and relaxed setting under normal conditions, in the morning, after personal hygiene, before breakfast, sitting comfortably with the arm at heart level and measuring blood pressure calmly, patiently, and consistently, as this best reflects the true, accurate, and reliable value of that individual's actual pressure under typical and everyday circumstances. All other changes no longer reflect the usual value, and the variations and issues arise. The complications caused by hypertension relate to the overall pressure regime, not a single isolated episode, and can significantly impact cardiovascular function and overall health. So what's the moral of all this? It's that information plays a crucial role. It plays a role nearly equal to therapy. Sadly, 1/3 of patients are unaware of their hypertension. However, it's also true that 1/3 of patients, despite knowing they are hypertensive, do not take treatment. This is likely the highest risk group we urgently need to reach out to and educate immediately to prevent serious complications.